Hello, this is Dr. Luke Rebnich, and this is how I perform the combined LASIK and Kamra procedure under the EX500 scope. I've already placed 3 temporal marks in order to help me place the tunnel entry. I then use a 4mm ring in order to mark the cornea centered on the inferior 2 white corneal reflections. I then dry the fornices and apply the Zemer laser as I would otherwise. Here I apply the Zemer between the temporal marks and the 4mm gentian violet ring that I've placed. And then apply the Zemer treatment at somewhere between 250 to 300 microns ideally, but allowing for 250 micron residual stromal bed as a minimum. I then apply the Zemer laser again, centered on that 4mm gentian violet ring. Applying the Zemer laser, I use an 8.5mm flap in order to avoid the pocket or the tunnel entry. And here I'm using a 110 micron flap. The next thing I do is open the edge of the pocket with a Sinskey hook. Remove the epithelium that may be on the Sinskey, and then open the edge of the flap in order to release any gas that may be trapped. I then place the camera spatula and dissect the pocket in a sweeping motion, realizing that there will be greater adhesions beneath the gentian violet. I then place the camera inlay, making sure to avoid any epithelium, applying just a small amount of BSS, and planning to overshoot that 4mm ring that I placed. Then I pull back, allowing the inlay to be placed exactly where I wanted it. Now, if I am unhappy with its placement, I use the camera inlay spatula, as seen here, to shift it ever so slightly. Now, after I've placed the inlay, I'm going to have the patient fixate on that green fixation light, and this should appear inferior. This has been perfectly centered, and now I use the spatula to reflect the flap, apply the laser treatment, targeting -75 to -1, depending on the patient's age. This treatment will be centered on the camera inlay, which the pupil tracker recognizes as the pupil. I then reposition the flap as I would otherwise. Using BSS on the cannula. Here I'm using acetate and a wet sponge to reposition the flap, topical antibiotics. And here I remove any excess fluid from the gutter, use Durazol, as well as the EX500 slit lamp to check for positioning. And thank you very much.